Assalamu alaikum. I'm Ifra Javed, having roll number 2021 TVM Evening 037. Today I will be presenting a very interesting topic titled as Uptake of Exogenous Estrogen as a Differential Diagnosis of Ovarian Remnant Syndrome in a Bitch. Our patient is a 6.5 years old spayed crossbred bitch weighing 8.4 kilograms. The dog was brought in with a history of recurrent estrus like signs for nearly 1.5 years, which is unusual in a spayed animal. These signs included valvular swelling, vaginal discharge, persistent pruritus, and a progressive bilateral flank alopecia. Such symptoms strongly resembled those of estrus, raising suspicion of ovarian remnant syndrome, which is clinically common when the ovaries are incompletely removed during spaying. Going through the history, the dog has been spayed very early, within the first 6 months of life. Despite this, the owner noticed intermittent heat like signs for the past 1.5 years, which is a significant red flag. 6 weeks before the first veterinary visit, the owner also noted progressive alopecia, particularly over the flanks. However, the most crucial information came from the detailed owner questioning, which revealed that the owner had been using a topical estradiol spray as a part of her menopausal hormone therapy. She had been applying it regularly for the over 1.5 years, and the dog often made close contact with her arms where the spray was used. This detail became a major turning point in this case, raising suspicion of chronic accidental estrogen exposure. On physical examination, the dog was in good general condition with normal vitals. Key findings were marked valvular edema, pruritus, bilateral flank alopecia, and a clear serous vaginal discharge. Mammary glands were unremarkable. These signs were suggestive of a estrogen effect on the reproductive tract. On diagnostic examination, we observed the vaginal cytology from the first exam showed approximately 90% superficial cells, indicating the strong estrogen influence. Ultrasound showed a visible cervical stump but no ovarian tissue near the kidneys. Hormonal testing revealed AMH level less than 0.01 nanogram per ml, consistent with no ovarian tissue, low progesterone level, slightly elevated estradiol, and a low LH level. CBC was normal with no evidence of bone marrow suppression. Together, these findings pointed away from an ovarian revenant and towards the exogenous estrogen exposure. On second examination, during the follow up visit, the owner had discontinued the estrogen spray or at least stopped applying it to the areas that the dog couldn't contact. Following this change, first of all, valvular edema had noticeably reduced, vaginal discharge has disappeared completely. Cytology now showed only intermediate cells with no superficial cells. Alopecia remained unchanged at this stage, which is understandable because the hair growth takes time. This rapid improvement strongly supported the diagnosis of exogenous estrogen exposure rather than the ovarian remnants. During the third examination, even more progress was seen. Complete resolution of valvular edema, no vaginal discharge, vaginal cytology returned to normal, showing the parabasal and basal cells only. Hair regrowth had begun, particularly around the mammary glands. These improvements confirmed that removal of the estrogen source resulted in a complete reversal of clinical signs. Differential diagnosis. At this stage, several differential diagnoses were made. First, ovarian remnant syndrome. This is ruled out based on very low AMH level, low progesterone, and ultrasound findings. Second, ovarian cyst or tumors only occur in the intact females, so these were excluded. The final confirmed diagnosis was chronic uptake of exogenous estrogen due to the accidental contact with the owner's topical estradiol spray. Heading towards the treatment and outcome, the principal intervention was simple: remove the source of exogenous estrogen, either discontinue the topical therapy or apply it to the areas that dog couldn't contact. Clinical signs resolved within the weeks and hair regrowth continued gradually. No further symptoms occurred after the exposure stopped. We recommend the continued gynecological monitoring until full recovery is documented. In summary, environmental or topical estrogen exposure can mimic ovarian remnant syndrome by producing estrogenic effects on the vulva, vaginal mucosa, and the hair coat. Small dogs are at high risk due to the frequent close contact with owners. Chronic exposure can cause serious problems such as the bone marrow suppression or a stump pyometria. So it must be considered in any spayed bitch with estrus-like signs. AMH testing is a reliable tool to exclude the ovarian tissue, and removing the estrogen source typically leads to the full recovery. Thank you.